evaluation and treatment for pudendal nerve involvement. So during the evaluation, I do ask you, how did it all start? And patients are so polite. They're like, kind of started a really long time ago. It's going to take a really long time. And you know what I say? Tell me. Go back as far as you can. Were you 2 years old and now you're 70? Tell me all 68 years. I need to know, because I have to find out what happened to you that you ended up here. And I promise you, I'll figure it out. So during the evaluation, I do really, really detailed evaluation of your life, right? Then of course, I look if your legs are the same length. Because think of it this way, a nerve is a thread. What tightened it? What manipulated it so it fires wrong frequency? Where did it got a little trapped that is now upsetting the nerve and telling the brain there is a dysfunction? So I measure your legs. I look at all the levels of your pelvis. I look very detailed at your spine. So once the spine is aligned and the pelvis is aligned, now the legs are the same length, right? I want to make sure that your hips are not compressing in. That's all outside work. That's all orthopedic, right? All friendly, nothing scary. Then I also have to see, what is your psoas doing? You know, everybody talks about psoas. It's because psoas will either put you in flexion or in extension. Flexion or extension. So if it's putting you in flexion and extension, it's manipulating your nerve, isn't it? Yes. Now I also have to look what diaphragm is doing, what the rib cage is doing. I look at your posture, because all of that changes, tweaks just a little bit of the tension on the nerve. Remember, the nerve lives inside a sheath, so it's supposed to slide inside the sheath. So if the nerve is inflamed, it gets stuck. So any pull will pull the sheath and the nerve together, and the nerve will fire pain. Rightfully so, because it tells the brain, I'm about to be stretched and damaged. Please protect me. So after that, depends on what the nerve is. It could be subcostal as 12. Forgive me, thoracic 12. Lumbar spine, iliohypogastric, ilioinguinal, gentle femoral nerve. It could be sacral plexus, which includes your pudendal nerve, your sciatic nerve, posterior femoral cutaneous nerves. There's a lot of them. But we know anatomy. We know where they come from, what spinal segment, and where they go course through and where they end. And then I manipulate every segment of it, all the way from the beginning to the end. And usually we find that little restrictions, little spasticity, little imbalance between the one side of the body to the other. And that's when I start to make that bucket list. I write down where the dysfunctions are, what I feel is pulling on your nerve, or opposite, slackening your nerve, what's causing spasticity here, dysfunction there. And now you have a bucket list that you could work on and cross off every week. Something gets crossed off until we get to the point where you say, I actually feel better. And I go, you see? So it's really not the nerve. It's the environment around the nerve that tensed it, pulled it, and made it angry. So now, once we release the environment around it, we decongested and decompressed all of it, and the nerve is able to fire, wait, you're at 75% now. Now my attention is going back to the brain and telling your brain, calm down, there's nothing wrong. We fixed the nerve, we fixed the environment, you don't have to fire. And that's when I kick in my therapeutic pain specialist certification information, and I fire at your brain and say, this is how you're going to change the narrative in the brain. And I give patients neurological homework to do, to talk to the brain every day, to calm the fear down, to calm the protection down. So when you take that combination of orthopedic, neurological, and brain neuroplasticity. That's the way to address pudendal nerve involvement.